Okay, here we go with class number 4, video lecture number 4 for the psychopharmacology course. And tonight, we're going to talk about anti-anxiety medications. You will notice here that anxiety medications, some of how they work are similar to the bipolar and depressive medications that we talked about before, but the neurotransmitters that are involved are going to be somewhat different. So, so I don't know, just to sort of review some of the basics of anxiety. Anxiety is also sometimes called nervousness. There are a number of different anxiety disorders, generalized anxiety disorder being the most common. Anxiety medications are used both to help keep the person sort of at a calm state when somebody has a more generalized anxiety disorder problem. And sometimes they are used to bring a person down from a very high level of anxiety. Sometimes in the form of what are called panic attacks or anxiety attacks, or just a high level of anxiety. So let's talk about there. I'm going to use two sets of slides here. The first is on a specific medication called called Xanax, and I'm going to start the presentation here. And give me 1 second here. Okay, the first one is on the anti-anxiety disorder or the anti-anxiety medication called Xanax. And I'm going to start here. This is an interesting. So 18% of the American population have some form of an anxiety disorder. And the most common, as you see here, is generalized anxiety disorder, which is considered to be extreme, extravagant anxiety and worry about commonplace events without any obvious reason to worry. Now, I don't know that I fully agree with that last part of the definition. It's not necessarily that there is no obvious reason to worry. It may be more accurate to say there's no obvious reason for worrying so much. And we're going to talk about the use of Xanax here, which is a medication that is used for the treatment of anxiety. And so when you talk about anxiety, these are the neurotransmitters. And notice this is the difference that all the medications have. You know, as we move along here, what I hope you're starting to see is the way psychiatric medications work. All is kind of the same process, but the neurotransmitters are different. Like, it's very interesting to consider when we talked about depression, serotonin was the neurotransmitter that was primary in the medications. We are not talking about anxiety, and the one that you will probably hear the most about is GABA. And then when we talk about antipsychotic medications, dopamine is the most prominent neurotransmitter that's involved. But we'll talk as we go along. But notice here that there are three. There are really four throughout the discussions that we have. There are four neurotransmitters that become the most prominent, or that will stand out as the most prominent: dopamine, serotonin, GABA, and norepinephrine. And in this case, what you probably will be hearing the most about is norepinephrine. But notice that three of them, dopamine, norepinephrine, and GABA, are the three. It's interesting to consider too that if you had to pick, if you had to say what category, what two category of diagnoses are the most commonly distinguished in terms of like the biggest differential diagnosis question, the two categories of psychiatric disorders that make up the clearest distinction within all the categories of psychiatric disorders, it would probably be depression and anxiety. Usually people are asked about are described as having either a depressive or an anxiety disorder, or a mood or anxiety disorder. Those are probably the cleanest distinctions in psychiatric discussion. And as you will notice here, the one neurotransmitter that is not mentioned here as playing a role in anxiety disorder is serotonin, which is the one that was primarily associated with the treatment of depression. So notice how the one transmitter that is most prominent when considering depression is not considered to be a neurotransmitter that plays a role in anxiety. So even though depression and anxiety can overlap, someone can have both depression and anxiety, they really are considered to be two distinct disorders. You know, if you think about in psychological assessment, when we talked about the Beck instruments, there is a Beck depression inventory and there is a Beck anxiety disorder inventory, Beck anxiety inventory, two distinct instruments. And it's interesting that you see here that the one neurotransmitter that is considered to be prominent in depression is the one neurotransmitter not listed here. Xanax is the #1 medication for treating anxiety. Okay, it is effective by acting on all the GABA receptors. And what medications that act on the GABA receptors do is they initiate sedation and muscle relaxation. It's interesting to keep in mind. Notice here what happens. The anti-anxiety medications don't necessarily lead the person to worry less. They don't impact on the worrying. They impact on the physical reaction to the worrying. The sort of theory behind this on a general sense is that if the person can be helped to be less tense, less stressed out, less physically stressed by what is bothering them, then their overall level of anxiety goes down. But notice it doesn't stop the person from worrying. It just stops the direct, intense physiological reaction that the worrying has on the person. Okay, and these are, you have to be careful. This isn't something we've talked about that much with medications, so I thought it was useful to point out here. We haven't talked about interactions. I mean, when someone gets on psychiatric medications, in this case, Xanax, there really is a lot of consideration that needs to be taken for what are called interaction effects. Interaction effects basically mean that that certain other medications can lessen the impact of the medication being used. So in this case, other psychiatric medications like Adderall, Ambien, Lyrica, Prozac, those can lessen the effectiveness of Xanax. Benadryl, Tylenol, Ibuprofen, over-the-counter medications can do that as well, and also medications for other um, medical problems. So not only medications for other psychiatric disorders, but medications for medical problems, including thyroid problem. So we haven't talked about that much. It certainly it goes into the chemistry much further than what we can talk about here. But there really is this degree to which you have to be careful about the degree to which certain medications and other substances will lessen the effectiveness of a medication like Xanax. These are some of the side effects. This is kind of funny. Sedation. Really, one of the biggest, dry mouth and trembling can be something, and by the way, I just had a patient who was on, it wasn't Xanax, it was Zoloft, and he and I were talking, and he has to go back and see his physician because he was on Zoloft, and this is a medication, this is a side effect, the trembling, which you're saying here with Xanax. This is an actual troubling side effects that actually is associated with a number of different medications, including, like I just said, Xanax and Zoloft, because it can catch people off guard. Like feeling tired and sedated when you're on a medication for anxiety can be expected. Maybe even having some sense of maybe not quite feeling steady, notice here, off balance, or feeling a little fuzzy in the brain. People tend to think, well, that's going to happen with a psychiatric medication, at least initially. It's something that they expect they'll get used to when they after they've been on it for a while. But this side effect, trembling, can really cause some concern because it can come out of the blue. That's what happened with this guy. He was actually taking Zoloft for treatment of it's not an anxiety medication, but for some reason the physician prescribed Zoloft. And what caused him more anxiety is he'd wake up in the middle of the night shaking. So this is just a side, sometimes it's interesting to consider the side effects. Not all the side effects, because there's a lot of them, but sometimes it's interesting to keep note of the side effects that may cause people the most concern. So trembling here is one of them. Another example of a side effect that really I told you the one before with medications like Zoloft and Prozac are sexual side effects, particularly men who cannot get erections when they're on those medications. That will cause a lot of distress. Another one that causes a lot of stress is, for some reason, a lot of ADHD or a lot of people on ADHD medications, particularly Adderall, will gain a lot of weight, and that can be real distressing. So that can be real distressing because of the health concerns. All of a sudden, well, I can pay attention better, but now I'm putting on weight and putting my health at risk. Can be a real concern. We talked about we talked about pharmacokinetics, which is sort of the category of how the medications interact in the body. It's easily absorbed. One of the things what this means is saying that it's easily absorbed is that it tends to have an effect relatively quickly. People who take Xanax will describe having a relaxed feeling relatively quickly. It's interesting to consider how it's not only interesting to consider the pharmacokinetics here, it's interesting to consider the pharmacokinetics in terms of how Xanax works versus antidepressant. An antidepressant does not improve the person's mood right away. Sometimes people will describe it taking 2 weeks for the impact of an antidepressant to be noticeable. But Xanax will work pretty relatively quickly, usually within 1 or 2 hours. It works by binding to the site of a GABA neutron. Uh, um, and But notice here, even though it's GABA, it's still associated with dopamine. So GABA and dopamine work together, but the primary. So dopamine is still noted here, but GABA, and this is interesting because even though depression, oh, I'm sorry, no, dopamine, not serotonin, I'm sorry. Please forget what I said there. But GABA and dopamine are related. So what tends to happen, what happens with GABA is it allows for there to be, uh, uh, I'm sorry, um, uh, it, it actually, so it increases GABA and increases dopamine. This is just this is another interesting thing about the interactions. I talked about medication interactions. This is interactions with alcohol. You feel is so what ends up happening if you drink more alcohol than the amount of Xanax you take, then you feel the alcohol. But basically, so if you drink more alcohol, then the intensity of the alcohol, you will feel a stronger effect of the alcohol. But if you take more Xanax than the amount of alcohol in your system, then the Xanax can really start to increase its impact. And too much, if you mixing alcohol and Xanax is never a good idea, but in particular, if you take more Xanax than the alcohol in your system. So if you take a lot of Xanax and even some alcohol, you can run the risk of putting yourself in a coma. This is just thing. So, okay. So, on that note, so that's a little bit about Xanax. Now, what I wanted to pull up next is I wanted to talk about the more general category of, excuse me here, let me just increase the size of benzodiazepines. Benzodiazepines is the largest category of anti-anxiety medications. The first one, 1955, was called Librium. Diazepam, 1959, and diazepam is Valium. Valium was very big in the 60s. Side note here, if you've ever heard the Rolling Stones' famous song, Mother's Little Helper, it's singing about Valium. Because Valium was seen in the 60s as something a lot of housewives took, both to deal with the boredom and depression, or the boredom and the stress of taking care of the household. So Valium was used as a way of sort of leveling them off. It was described as a way of leveling off their stress level. Now, benzodiazepines are the most common and most effective grouping of anti-anxiety medications. Prior to that, there were barbiturates were used, but those were replaced by benzodiazepines, like I said, during the 50s. Some of the names of benzodiazepines, those we just talked about, Xanax. That is like I said, the most common type of anti-anxiety medication, and Ativan. Now, notice here, Xanax is the number one. Ativan's number two. I think it's number two. Sometimes Valium's number two. But these three are the most common: Xanax, Ativan, Valium. But notice that the two most common, the two at the top of the list, are considered short acting. Because that's the problem with anxiety medication is it's a good thing to, calm the person down. The problem being is you could calm them down too much, or you could have them relaxed for too long. You've got these medications here, which I will be honest with you, I've never known. Let me look here. Yeah. Okay. Now notice that this list goes. So as far as the amount of time that it works for, you've got this, 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 and this. And I will tell you, I don't think I don't recall ever seeing anybody on any of these. Because notice how long they work. I mean, this one, 40 to 200 hours. So basically, this is a medication whose sedating effect lasts almost 2 days at a minimum, and just doing some quick math there, 8 or 9 days as a maximum. So you've got medication here that can go from 5. So the effect of the different types of benzodiazepines can go from 5 hours to 200 hours. So these are definitely, as a grouping, the most common. These 3 medications make up the vast majority of anti-anxiety medications, and then you have these other ones. Some of the reasons that benzodiazepines are better for treating anxiety than barbiturates or other types of anxiety medications. High therapeutic index, which basically means they're safe from a physical point. They make that comment here that you could take 20 doses of a denza, but somebody could try to commit suicide could take 20 pills and still not kill themselves. They do not have associated respiratory or cardiovascular problems, which barbiturates have. This is an interesting thing here. This is an interesting, this is a psychopharmacology course, and certainly because we're a clinical psychology program, the emphasis is on the psychiatric psychological part. But some of the pharmacology stuff about medications is fascinating, to delve into. Notice this one: practically no action on other body system. Remember, we talked before when we talked about the antidepressants. We talked about how they tend to have impacts on other body systems. Serotonin tends to have impact on other body systems, particularly the stomach. In this case, it's interesting to think from a pharmacological point of view, the difference between these two medications, because you have anti-anxieties which act, benzodiazepines which act relatively quickly and have no effect on other parts of the body, compared to some of the antidepressants we talked about, particularly the SSRIs and the SNRIs, because they have serotonin, because they're increasing the amount of serotonin, they tend to take a while to have a maximum effect, and they have a lot of impact on other body systems, particularly the stomach. Little distortion of sleep pattern, less negative effect on other medications, although than other drugs, but they do still have it, as we saw in the last one. Tolerance is mild, lower abuse liability. Benzodiazepines are not seen as being as having danger for addiction. Okay, let's go through a little bit of how they work. They increase the efficiency of GABA, and what GABA does is it decreases the excitability of neurons. So it has a calming effect on many of the functions of the brain. So basically, it decreases the communication between the neurons. So it slows down the communication between the neurons. Um, so some of the, so I just want to go through this next part just to show you um, some of the chemicals that are involved here. Notice um, chloride um, and chloride is the specific chemical. You're basically when you get chloride involved, it basically slows everything down. So that's essentially GABA is the neurotransmitter, but one of the things it does is it increases the amount of chloride, which helps calm the neurons down, helps to decrease the communication between between the neurons. Let me just see. I wasn't quite sure if I was gonna. Let me just see this. So let me see if I can. I can increase. Okay. So what you see here is there. So you got here. This is a cell. You know, this is the cell here. So no, this is I'm sorry. This is the neuron. So what you end up having here is you've got the normal. So you've got no chlorine going in here, and then you start to have a normal flow of chlorine into here. But if the person has anxiety disorder, there's an indication that the communication between the neurons is speeding up. So you need to get some more chlorine down because that's going to slow it down. So you put in the benzodiazepine, and what ends up happening is more chlorine comes in to the neuron, and that chlorine helps to slow the communication between the neurons down. This is more the pharmacological stuff. I'm kind of going to skip over that. Okay, so some of the things that benzodiazepines can be used for, we've already talked about anxiety disorder. They're sometimes used clonazepam. You know, that's interesting. It's interesting to keep in mind that let me go back to something here. Clonazepam was hold on a second. Yeah. Okay, notice this. Clonazepam is a longer acting one. This is one that can be 30 to 100 hours. Okay, so you've got clonazepam, which can be 30 to 100 hours. And I want you to keep in mind something here. Notice what this says over here. Keep in mind that, remember that one. Clonazepam is sometimes used for treatment of bipolar disorder. So it's an anti-anxiety medication that sometimes is used as a way of treating mania. It's anxiety, it's an anxiety medication, but it has been shown to have some effectiveness on bipolar disorder. Notice also that diazepam, which is a longer acting one too, is sometimes used for treatment of alcohol withdrawal. So if you saw some of the longer ones, the longer acting ones, and wondered, well, why would you even bother using those? They are used as a sedating medication for disorders other than anxiety disorders, which include alcohol withdrawal and bipolar disorder. Okay. Yeah, I know there are other videos to watch this week, so I'm going to have you look at those. But I wanted you to keep in mind this whole idea of, not only how benzodiazepines work and specifically how Xanax works, but this whole, I want you to start getting a sense of how things are different between the anti-anxiety medications, which again tend to be quick acting and tend to They tend to be quick acting, and they tend to target just the physiological aspects of anxiety, compared to antidepressant medications, which tend to take a longer time to build up into the system and have an effect, and do tend to affect other body systems. So, even though the medications are working sort of on a similar process, notice it's all sort of the same process. The medication does something to the neurotransmitters. It either lets more chemicals get out of the body by stopping how much is reabsorbed into the cell, so there's more of the chemical out there. That was the case with serotonin, or it lets in certain chemicals that change how the neurotransmitter is operating. So in this case, it would let in more chlorine as a way of impacting how the neurotransmitter is operating. Okay, I think that's good for now. Like I said, I know you have other videos, and then let me know if you have any questions, and I will see you on Thursday.